Hello, everybody. Good afternoon, and welcome to Positive Approaches to Behavior in Children and Adults, sponsored by Partners Health Plan. My name is Alicia Andrevine, and I am the Director of Recreation Services here at ADAPT Community Network. At ADAPT, I like to think I'm in charge of all the fun activities. We host a Friday night disco, we host Saturday recreation, and we host supplemental Dayhab. First, a couple of housekeeping rules. Please put any questions for presenters in the Q&A. If you are having a technical difficulty, there will be answers to common questions in the chat section. This session is being recorded, and you can watch it again online at www.adaptcommunitynetwork.org. Please also follow us on social media at Adapt We Change. It is my pleasure to welcome you to today's session featuring Dr. Avigdor and Michael Boardman. Dr. Avigdor is a licensed psychologist and Director of Psychology of Adult Programs for ADAPT Community Network. He has over 10 years of experience working in agencies that serve individuals with developmental disabilities. He provides support to Article 16 clinic, residential, and day habilitation programs throughout the agency. Michael Boardman is a board-certified behavior analyst, a BCBA, and licensed behavior analyst, LBA, with ADAPT Community Network. Michael has over 23 years of experience working with children with developmental disabilities. His interests led him to the field of behavior analysis, which is a science focused on the application of behavioral principles to the needs of individuals and their families to promote behavior change and improve quality of life. Michael provides behavioral support to ADAPT's preschool programs. Let's get started. Please welcome Dr. Avigdor and Mr. Boardman.
Alicia, thank you so much for the introduction and for moderating this forum. I also both of us want to thank the Family Connect and Project Connect for putting together such a great forum. Also, I want to thank Michael for putting together the slides themselves. They're very informative, and I hope that everyone here finds them informative as well. So the first thing I'm going to try to do here is just share the screen and maximize that for everyone to be able to see. And like I said, thanks again. We are going to be presenting today on the positive approaches to behavior, also in this case, understanding, preventing, and responding to challenging behavior. So the objectives for today. We're going to define challenging behavior and reframe the way we think about them. We're going to identify the two types of reinforcement and how they influence the learning and maintenance of behavior. We're going to name the 4 functions of behavior. We're going to name some tools for determining the functions of behavior. We're going to identify strategies to prevent challenging behavior. We're going to identify potential replacement behaviors for challenging behavior. And finally, identify strategies to respond to challenging behaviors so that is less likely to occur in the future. So what is a challenging behavior, right? We're starting from the first thing that we usually is seen. It's any repeated pattern of behavior that interferes with an individual's optimal learning or engagement in pro-social interactions with others. Okay, and there are a couple examples listed below. The important thing that I want to point out here is that we're talking about behaviors that are a detriment to the person, to that individual, or to others, right? So it's a detriment. It's not something that you may kind of find annoying at times, right? We all have behaviors that we do that are deemed annoying, right? Everyone has like that annoying thing. That's not a challenging behavior. We're looking at things that can severely impact the individual or yourself or others in the situation, right? Those are the things that you're trying to correct, you're trying to make a positive thing out of. So how can we reframe the way we think about challenging behavior? When we encounter challenging behavior, it evokes a variety of emotions, including frustration, anger, disappointment, and confusion. So be careful, because we want to avoid assigning the behavior to the individual. Once you get those feelings that were mentioned above, you might think, oh, this person's just aggressive, right? Or this person just doesn't listen. Such phrases suggest that the individual is deliberately choosing to engage in challenging behavior over appropriate behavior. Okay, so the important thing is you are kind of assigning intent over here. You're saying that's what they're trying to do. Now, we're going to talk about reframing this challenging behavior. Okay, so you're going to take the challenging behavior away from the individual. Instead of he's aggressive, think he hits the staff when we ask him to clean up for morning meeting. So now you have an objective look at what's going on. So reframing it, makes us ask, why is the individual doing this? What can we do differently, right? So this is where it gets into function, all right? To begin the behavior change process, we have to understand that the purpose or the function is serving the individual, okay? They're doing this as a means to get something, to do something. We're going to discuss this more, but the function is really what we need to determine. What the individual is communicating when they engage in this difficult behavior. All behavior is learned and serves a particular function, right? So behavior occurs in the context of our environment. Whether we continue to engage in that particular behavior is dependent upon the immediate consequence of the behavior and the antecedent events that signal the availability of those consequences. Positive reinforcement and negative reinforcement are two basic environmental functions, maintaining variables or reasons for the occurrence of all behavior, including challenging behavior. Positive reinforcement occurs when the events presented following a behavior result in an increase in that behavior under similar circumstances. Okay, so presented is a key word here. We're presenting the environment here. The positive reinforcers are the specific events that increase the likelihood of the responses that produce them. It's just some examples would be, let's say, attention, getting a toy, or receiving food. And we're going to go into those. Now, it's important to know what is a positive reinforcer for one individual may not be for another. All right. So two important things. Two different individuals can have different reinforcers, even if they like the same thing. Right. So both people, let's say, can like, ice cream, but it might not necessarily be reinforcing for one, and the other one it is. So the reinforcer is the part that is going to get them to continue the action, right? And the other part is that just because the individual likes it doesn't mean that it's a reinforcer, right? And I think in that first point that I made, that kind of hinted at that, right? So not everything that someone likes is always going to necessarily be the cause for increasing the behavior. all right? Two examples here of the positive reinforcement scenario. A 5-year-old student asks a peer for a toy and the peer gives it to him. If this student continues to engage in asking peers for toys over time, we say that their behavior was learned and maintained by positive reinforcement. Now in situation B, a 5-year-old non-vocal student hits a peer to access a toy and the peer gives it to him. If this student continues to engage in hitting peers to access toys over time, we say that their behavior was learned and maintained by positive reinforcement. Okay, so they're both getting this, they're both getting their reinforcer, just in a different way. The above two examples demonstrate positive reinforcement at work. While both students' behaviors serve the same function, positive reinforcement in the form of access to a toy, student A's behavior is appropriate and pro-social, while student B's is maladaptive and potentially problematic. Negative reinforcement. So negative reinforcement occurs when the events are removed following a behavior, and those result in an increase in that behavior under similar circumstances. Okay, so the behavior increased as well, but in this case, the events were removed. Okay, negative reinforcers following a behavior increase the likelihood of the response that removed them. Unlike positive reinforcers, negative reinforcers are typically aversive to the individual. Examples of negative reinforcers are a challenging task, an unfriendly person, distasteful food, or waiting at the doctor's office. Same thing as before, when a negative reinforcement for one individual may not necessarily be a negative reinforcer for another individual. So again, same mantra, a reinforcer only functions as such if it increases the behavior that precedes it. We're going to give two examples here of a negative reinforcer. A teacher serves a 5-year-old student strawberries for snack. The student doesn't like strawberries and says, "No, thank you. Can I have something else?" The teacher offers her a choice of other items, one of which she likes. If the student continues to use vocal requests to avoid potentially aversive situations, under similar circumstances, we say that her behavior was learned and maintained by negative reinforcement. Now, in the next scenario, a teacher serves a 5-year-old nonverbal student strawberries for snack. This student doesn't like strawberries and cries and throws them on the floor. The teacher prompts him to pick up the strawberries and throw them away, and then offers him a choice of other items, one of which he likes. If this student continues to engage in crying and throwing to avoid potentially aversive situations, we say that this behavior was learned and maintained by negative reinforcement. So the two examples demonstrate negative reinforcement. Both students have the same, ended up getting the same function, right? The negative reinforcement in the form of escape, okay? But student A's behavior, we would say, is appropriate, and student B's, we would say, is not appropriate. The 4 functions of behavior, right? So this is, we spoke about reinforcers. Now we're speaking of why they engage in the actual behavior, okay? So many of the people we support, when they have significant global developmental delays, including absent vocal repertoire, sensory processing delays, motor delays, and limited play skills, a history of reinforcement for the occurrence of challenging behavior combined with certain environmental conditions set the stage for or increase the likelihood of that behavior. When we are looking at the challenging behavior, we can categorize them by the functions they serve. The first function is self-stimulation. The individual is engaging in the behavior because it feels good. Attention, they're engaging in the behavior to obtain attention. Tangible, they're engaging in the behavior to get something, an item or an activity. Escape, they're engaging in the behavior to avoid something, okay, that they don't like. Now, when we think of these four things, okay, the most important thing is we want to first rule out a medical component, right? And some people use the term MEATS, medical and the four that we just mentioned, as an acronym, right? You know, it's sometimes easy to jump to one of these four if we didn't consider that the individual might have something wrong physically, and they're trying to communicate that to us, right? So the first thing always is to think if there's something medical. Here's some examples, right? I know this is a lot of information, so examples sometimes help. The antecedent in first condition, okay, their individuals understimulated, right? There's a light switch present. The skills deficit might be limited play skills. The behavior, they would flick the light on. So the consequence, sensory stimulation, right? Now, the long-term effect is they're going to continue to do this. They just got what we call automatic positive reinforcement. They got sensory stimulation from engaging in that sequence. The next one, absence of social interaction, okay? Their skill deficit might be that they're non-vocal. The behavior will be that they climb on the windowsill. The immediate consequence is that the teacher sits with the child to prevent them from climbing. The long-term effect is that they're more likely to climb on the windowsill in the future. So now the chain was, they got the attention, they got the positive reinforcement. Next condition, playing with a highly preferred sensory toy. The teacher asks the child to put it away. It's time for circle. The skills deficit, just like the example before, the individual's non-vocal. The behavior, self-injury, right? So this child might start hitting their head. Immediate consequence, teacher returns a highly preferred item to the child and lets him hold it. Again, long-term effect, more likely to engage in it, okay? More likely to hit themselves. The principle is that they obtained what they wanted. So they got the tangible need met, right? And that's also a positive reinforcement. The last condition is going to be negative reinforcement. It's the only one that's negative reinforcement. There's a non-preferred task. The TA tells the child to sit for the morning meeting. They also are non-vocal, right? Might be limited in seating behavior. So the behavior is they run away from the TA. The consequence, they avoided the morning meeting. The long-term effect, they're more likely to run away from the morning meeting. So they just avoided something that they didn't want to do. All right, so those are all the examples. There's many different examples, but I just wanted to kind of give a little flow of every type of scenario for those different functions. I think now I'm going to turn it over to, oh, I'm sorry, there's one or two more. The functional assessment, right, we're going to talk about now. when we're faced with an individual who engages in challenging behavior, it is extremely important that we analyze their behavior to determine its functions, right? And this is what gives us the who, when, where, why, how, right? That's really what a functional assessment is. That's what helps. That's kind of like the closest scientific thing we have to determining why that child or adult engages in behavior. And some of these tools below, there's one called the FAST. That's a very popular one, the Functional Assessment Screening Tool. And there, once the slides are shared, there is a link here that will show the standard 16 items that are administered. There's also the ABC data collection form. Now, this is a tool that helps us record information about a particular behavior, okay? The A in it is the antecedent, the B is the behavior, and the C is the consequence. This ABC form is what most behavior specialists, most clinicians use to determine the function, right? So even just sort of having that as a reference, it's always a good thing for anyone to be familiar with, because it'll help you to get an idea of some of those concepts that we just, we just looked over. And finally, this is an example of an ABC sheet. So you have the time, right? The activity and the staff that were present. You have the antecedent, what occurred beforehand, the behavior, right? The consequence, what were the results? And finally, any comments. So, this could really be used in almost any environment. I mean, even though we use it most at day programs and group residences, this could really be used in any environment to help identify the function. And after this, I'm going to turn it over to Michael for the next slide.
Thanks, Avi. Okay, now that we've defined challenging behavior, reframed the way we think about it, identified the 4 functions that influence its development, identified its 4 functions, and discussed ways to assess it, it's time to look at intervention strategies or behavior change strategies. When it comes to a comprehensive behavior change program, a number of elements are critical for success. But just for the purposes of today's presentation, we're just going to be discussing the following 3 elements: replacement behaviors, antecedent strategies, and consequence strategies. So we'll start with replacement behaviors. Replacement behaviors are appropriate behaviors that serve the same function as the challenging behavior and are taught and reinforced by staff. Antecedent strategies are strategies we use before the challenging behavior occurs. Typically, these are strategies we implement throughout the day to prevent its occurrence. And finally, consequence strategies are strategies we use after challenging behavior occurs. These strategies are designed to no longer reinforce the challenging behavior so that it diminishes in frequency, duration, and intensity over time. Next slide. So let's start with replacement behaviors and get into a little more depth here. Again, replacement behaviors are appropriate behaviors that serve the same function as the challenging behavior and are taught and reinforced by program staff. The idea here with replacement behaviors is it makes challenging behavior unnecessary. So below are replacement behaviors based on the function the challenging behavior serves the individual. So let's look at sensory first. Recall that self-stimulatory behaviors are behaviors the individual engages in because they feel good. For behaviors maintained by sensory stimulation, the goal is to teach the individual an incompatible behavior that matches and competes with their challenging behavior. Matched means that the replacement behavior provides the same stimulation as their self-stimulatory behavior. For example, prompting and reinforcing a child to use a chewy tube as a replacement for mouthing objects and other inedible items. And compete means that their replacement behavior prevents them from engaging in self-stimulation. So here, with this same example, if you can imagine, if this child is using a chewy tube to mouth, they can also be mouthing other objects. Next slide. So for challenging behavior maintained by access to attention, the goal is to teach the individual two separate skills. First, we want to teach them appropriate ways of accessing attention. And the second is we want them to learn to wait for attention. So to start, we need to teach the student to request attention using a mode of communication that matches their abilities. So for some, that's going to be using words. For others, that might be gestures. And for still others, that might be American Sign Language, or an augmentative and alternative communication device like Proloquo2Go, or PECS, which is a picture exchange communication system. So to teach this, we create opportunities for the student to engage in the communication response throughout the day, or when opportunities arise incidentally. To evoke the communication response, we prompt it. So for the child who uses words, we're going to use a verbal prompt. For the child who is using ASL or PECS or an AAC device, we're going to use an imitative prompt or a model prompt. And then as soon as they engage in that behavior, whether it's prompted or not, we're going to reinforce it immediately by providing the student with the attention they're seeking. If we work on teaching this skill throughout the day, the child or student will have many opportunities to practice, which will increase the likelihood that they learn and maintain this critical skill over time. So once we've taught the communication response, we also need to teach them to wait for preferred person's attention. Why do we do this? Well, the reality is attention from a preferred person is not always immediately available. Sometimes we need to wait. So to teach this skill, we shape a wait response using visuals like first wait, then, mommy will come play with you, and a timer to indicate how long they have to wait. To start, we teach them to wait for very short durations of time, like 10 seconds. And as they build success with those shorter durations, we lengthen the time until they can wait for durations of time that are reasonable for their age, developmental level, and the setting in which we're in. So these are replacement behaviors for those students whose challenging behavior is maintained by access to tangibles or items. Here, the goal is to teach the individual two skills. One, and this is very similar to the previous example. One, we want to teach them ways of accessing their preferences. And two, we want to teach them to wait for their reinforcers. So to start, we need to teach the individual to request their preferred items using a mode of communication that matches their abilities. To do this successfully, I suggest teaching the communication response during both structured teaching sessions and incidentally throughout the day. For your structured teaching sessions, sit at a table across from your learner and have their reinforcers in front of you. As they declare motivation for a particular item, i.e. they reach for it or stare at you in anticipation of getting it, prompt the target communication response and reinforce them with the item they're requesting. Over time, delay and fade your prompt until they are producing the communication response on their own. In addition to these structured sessions, teach the communication response incidentally throughout the day. So for example, if we're working on teaching the individual to request open, we might do that incidentally when we walk the individual to the bathroom. So as we approach the classroom door, we sort of wait for them to produce a response. If they don't, we prompt it and we say open. And if or when they imitate that response by saying open, we open the door. And this teaches them during sort of routine activities incidentally throughout the day. So again, once the communication response is firmly a part of their repertoire, we also need to teach them to wait for the preferred items. So to teach this skill, we shape a wait response, just like we did with the attention function, using visuals and a timer to indicate how long they need to wait. Thanks. As they build success, we lengthen the time until they can wait for durations of time that are reasonable for their age, developmental level, and the setting in which they're in. Next slide. So these are replacement behaviors for behaviors maintained by escape avoidance. So recall that some challenging behavior is maintained by negative reinforcement. That is, the individual engages in the behavior to remove a stimulus or event that they find aversive. We refer to these behaviors as escape or avoidance motivated. The goal with these types of behaviors is to teach two important skills. One, ways to avoid or terminate aversive or less preferred events appropriately. And two, compliance in response to requests to engage in less preferred tasks. So similar to the replacement behaviors we teach for behavior maintained by access to attention and tangibles, we'll want to teach the individual appropriate communication responses that allow them to terminate, delay, or avoid less preferred activities. Termination responses include all done or finished, or I need a break. A delay response could be something like I need 2 more minutes. And avoidance responses include no thank you, or I don't like that. The teaching of these communication responses is typically done during planned routine activities and incidentally throughout the day. While the above communication responses are critical in an individual's repertoire, so is their ability to tolerate and comply with demands to engage in less preferred activities like academic instruction, activities of daily living, group instruction, exercise, etc. We teach compliance by shaping their engagement in successively more challenging demands. To start, we have the individual engage in a short and easy task and reinforce their participation with access to a potent reinforcer. Over time, we reinforce the individual's engagement in successively longer and more challenging tasks until they're able to comply with tasks in a manner commensurate with their peers. Okay, so we started by talking about replacement behaviors. Now we're on to the second element that's necessary in a behavior change package, which is antecedent strategies. Again, antecedent strategies are strategies we use before an instance of challenging behavior and are designed to prevent its occurrence. Typically, antecedent strategies are ones we have in place throughout the day. Below are 11 examples of antecedent strategies. This is certainly not an exhaustive list by any means, but I do think it's a good start. So a predictable daily routine. Routines establish normalcy and predictability for the individuals we serve. Daily routines include greeting staff and peers, unpacking, mealtime, playtime, work time, and motor time. As you create your daily routine, think about the order of activities in which you engage your students and try to alternate between preferred activities and demand activities, seated activities and movement activities, teacher-directed activities and student-directed activities. Over time, exposure to a consistent daily routine teaches our students what they are supposed to do and when they are supposed to do it, which promotes their independence, boosts their confidence, and reduces challenging behavior. Visual supports. Many persons with developmental disabilities find it hard to focus on what they are hearing and need a visual picture to help them understand our expectations. Pictures and symbols give extra clues to support what is being said. When language is a barrier for them, visuals help. So visual schedules. Visual schedules are vertically or horizontally displayed schedules where picture icons represent the activities the individual will engage in and the order in which they will occur. These schedules help the individual anticipate what is coming next. A good visual schedule will alternate between demand activities that the student needs to engage in. Those tend to be learning activities, and activities that the student enjoys. So, Avi, could you switch to the slide with the example of the visual schedule? So here is a vertically displayed visual schedule for a student who engaged in a variety of escape-motivated behaviors during his classroom morning meeting. The first 8 pictures represent the 8 short activities the students engaged in during their daily morning circle time. The 9th picture indicates a special surprise that the student could earn contingent upon his participation in the activity. So each day when the student attended circle, he held this paper visual schedule on a clipboard and put an X through each short activity as it occurred. After the final song, which is that second to last picture in the example, he could earn a prize from a treasure chest. This schedule and its accompanying reinforcement contingency help the student see the duration of the activity and anticipate its completion, allowing him to participate without challenging behavior.
I'm sorry, guys. I'm sorry. Please excuse the interruption. I just want to let you guys know it's a quick reminder that we have 10 minutes before we start taking questions. For everybody else, please start submitting your questions for our panelists through the Q&A section of Zoom here at the bottom of the screen. Okay, guys, 10 minutes before the Q&A. Thank you.
Okay, so the second visual support is what's known as a choice board. Choice boards are menus containing pictures of a student's preferences. For individuals who are non-vocal or struggle to make vocal requests, choice boards allow them to see what's available and indicate what their preference is without using challenging behavior to do so. Avi, if you could go to that example, thank you. So here is a choice board for a vocal student who needed visual support to request a calming activity during group activities that had previously resulted in very explosive meltdowns. Each white square contained a tab of Velcro and affixed to it a picture icon representing one of the calming activities available to her. While the student was highly motivated to participate in large group social activities with her peers, she was easily disappointed when the events that transpired during these activities didn't go exactly as she wanted. With the choice board, she was able to choose an alternate activity to engage in away from the group, which prevented her from those meltdowns that she often engaged in. The next visual is a first-then board. First-then boards are used to help support a verbal contingency. As professionals and caregivers, we know which activities our students or children like and which ones they don't like. First-then boards can be used when you want your student or child to engage in a non-preferred activity and demonstrate to them that good things will come immediately following. So for example, first take a bath, then you can watch a preferred video. And I have an example of what that looks like. So here, this is the first-then board. So you would take the picture of the demand activity or the activity you want the child to engage in first, and then in the then box you would affix with Velcro and a picture icon the reward activity. So again, in the example I used, first bath, then video. And the last visual support is a timer. Timers show the individual how much time they have with the preferred activity or how much time they must engage in a less preferred activity before they can access their reinforcers, which helps them anticipate a transition and reduces the likelihood of challenging behavior. The next antecedent strategy is clear and concise language. When we give verbal directions or redirect inappropriate behavior, it is extremely important that we keep our language simple and to the point. We do this by focusing on communicating what we want the individual to do, not what we do not want them to do. Phrases like stop, don't do that, you're not listening are confusing to the student who is touching a peer's hair and causing them to cry. Such phrases do not communicate to them what it is we want them to do. On the other hand, phrases like hands down or hands in your lap, especially when paired with a teacher model or visual cue, show the student what is expected. Embed choices into demand activities. Oftentimes we ask our students to engage in activities that are necessary for their skill development, but are not among their preferences. Embedding choices into these demand activities gives our students some control over situations they don't want to be in the first place and increases the likelihood of their compliance and success. Pair reinforcers with demand activities. Another option for students who struggle to participate in certain activities is to pair their reinforcers with their participation. For example, providing a preferred toy to hold or a preferred edible to snack on contingent upon their in-seat behavior during a group lesson is a highly effective antecedent or preventative strategy for the child who previously dropped to the floor or eloped from an activity location. Catch them being good. As the mantra suggests, catch them being good means we look for and reinforce the positive behaviors our child or student engages in. This sounds simplistic and obvious, but as parents with busy schedules and staff with groups of individuals to manage, it is not uncommon to find ourselves redirecting inappropriate behavior and forgetting to praise appropriate behavior. Catching them being good lets our children or students know that we notice when they do good things. It also shows them the types of behaviors that result in reinforcement. For some, a simple phrase like, "I like the way you're playing with your friends," coupled with a high five will suffice. For others, we may need to sweeten the pot a bit by pairing our social praise with something that is more tangible, like a preferred toy or edible.
I'm sorry, Mr. Boardman. I'm going to just excuse you guys once again and want to remind everybody we now have 5 minutes before we start answering people's questions. Okay, panelists? 5 minutes before we start taking questions. Thank you.
Offer alternatives when saying no. When our children or students want something that they cannot have, either because it's not an appropriate time for it, they've had enough of it already, or it's not available at the moment, saying no or no, you can't have that often results in challenging behavior. However, when we change our language from no to no, but you can have the following, we let our students know that we understand that no is hard, and we let them know that other options are available, some of which they might like. Offering alternatives when saying no redirects our students to what is available and often makes the no easier. Schedule preferences and special attention throughout the day. When we provide our children or students with access to their favorite toys, activities, and our special attention on a schedule that alternates between these activities with the demand activities, they are less motivated to engage in escape-motivated, challenging behavior and are more inclined to comply with our demands. We see this improvement in their compliance because they're learning that they've learned that when they are with us, good things are always around the corner. Prompt communication. During situations that often result in challenging behavior, it is important that we are available to prompt communication. This strategy works especially well with challenging behavior that is maintained by access to tangibles, access to attention, or escape from demands. When we prompt a request for a preferred item, a request for our attention, or a request to terminate an activity during those situations that previously resulted in challenging behavior, we turn previously challenging situations into teachable moments. For example, when we prompt a request for a toy for the child who has a history of using hitting to access toys from their peers, or when we prevent an occurrence of that challenging behavior and turn a previously problematic situation into a teachable moment for that student. Enriched environment, proximity control, and prompting. For our children or students whose challenging behavior is maintained by self-stimulation, so again, that's one of the 4 functions. It's the first one we discussed. It is extremely important to fill their environment with interesting, stimulating, and developmentally appropriate activities that match and compete with their sensory reinforcement, with the sensory reinforcement that is maintaining their challenging behavior. For some, this alone will compete with their self-stimulatory behavior. Keep them busy and engaged, and they're less likely to engage in self-stimulation. For others, though, we may need to be available to provide one-to-one support in the form of proximity control, or the degree to which a staff person is near to a student to manage their behavior, and prompting to teach them to use these new materials appropriately. Over time, as our students develop the independence to engage with these materials functionally and on their own, their active engagement will compete with their motivation to engage in self-stimulation, and we can fade our one-to-one support. So this is the last element we're going to be discussing today. These are consequence strategies. These are strategies we use after challenging behavior occurs. These strategies are designed to no longer reinforce its occurrence so that it diminishes in frequency, duration, and intensity over time. I'm sure you all know this. Behavior change takes time, patience, and consistency on the part of staff and caregivers. Even when we have preventative strategies and replacement behaviors in place, our students will continue to engage in challenging behavior as we start the behavior change process. With consequence strategies, the goal is to withhold the reinforcement that was previously maintaining the challenging behavior. As we've discussed, challenging behavior serves 4 functions. Our consequence strategies need to match the function that it serves the individual. Below are consequence strategies for challenging behaviors based on function. So the first is for escape. For our children or students whose behaviors are maintained by escape from demands, we keep the demand on while ignoring the behavior itself. Keep the demand on means we prevent the individual from leaving the activity location and prompt their engagement in the task until they comply. Ignore the behavior means we remain calm, we refrain from reprimanding them, we block access to their reinforcers, we avoid eye contact, and block attempts at aggression or self-injury. Of all the procedures we use, this procedure, also known as escape extinction, can be distressful for our students. As such, it is extremely important that we remain patient, understanding, and compassionate as we work them through this process. Our children need to learn to engage in tasks that fall outside their preferences. And yes, we're going to do our best to implement antecedent strategies and teach replacement behaviors that reduce their engagement in escape motivated behaviors. But in some situations, those alone don't work, and escape extinction is necessary. So this is the consequence strategy for behaviors maintained by attention.
Sorry, Mr. Boardman.
Yeah, that's
I'm
fine.
going to have to stop you here and interrupt. I would like to thank you, gentlemen, both Dr. Avigdor and Mr. Boardman, for such a wonderful and great presentation. But we do have a few minutes to take some questions from the audience, so I'm going to begin now.
Okay, can I just say one thing? We're going to be,
Sure.
for those of you who would like it, we will send out the full PowerPoint set of slides so that people can see. There were 3 more slides left, so people can see the whole presentation. And I apologize for taking too much time.
No, thank you so much. We just have so much to go over in today's training. So
Not a problem.
I will, if you don't mind, guys, I can give you time to summarize your presentation before we start the first question.
Sure. Avi, could you go back to the slides, please?
Oh, I'm sorry. Hold on.
That's fine. Okay. To sum up today's presentation, we learned about reinforcement and how its processes influence the development of challenging behavior. In addition, we learned about the functions of behavior and how determining a behavior's function informs the development of replacement behaviors to teach antecedent strategies and consequence strategies. The purpose of today's presentation was to give you a better understanding of challenging behavior and the strategies we use to reduce its occurrence and teach appropriate alternatives. Thank you guys so much for participating, and let's move on to the Q&A now.
Thank you so much, Mr. Boardman, and I do apologize if I didn't give you enough time to get that together. Okay, first question. How do we improve behavioral management trainings for our DSPs? What are the approaches and trainings you would recommend?
I mean, I would recommend, a similar training as we provided today, but with also a hands-on piece. So whoever's doing the training should not only provide the theoretical piece that we've just presented today, but also spend some time with the direct service providers to model for them how to implement these procedures. Because this is a lot of information, and to just read this, you can't just then go and implement it on your own. It definitely requires some hands-on training. So I think that would be the best approach.
And just to add to that, a lot of agencies, they have the annual trainings. One of the big pieces is behavior management. It's embedded in the annual learning management. So most agencies are trying to put the positive approach to continuing education on that, and whatever the newest behavior trends are to train staff.
What is the best type of therapy for addressing behavioral challenges for individuals with ID and DD? Is there a specific type of therapy or therapist I should ask or look for?
That's a very good question. There's different modalities. In other words, different approaches that are used. And, we do offer ADAPT, as well as many agencies offer counseling as well, through clinic. And with those counseling services, there are many different approaches. So some approaches they use are cognitive behavioral therapy, or the humanistic approach, where there's a connection between therapist and the individual. There's so many different types that are offered, and it really depends. I would say it depends on the individual. Some are more effective than others.
Okay.
Could you repeat the question though? Are we talking about providing support to families who have children who are engaging in challenging behavior? Is that the question?
I'll repeat the entire question. What is the best type of therapy for addressing behavioral challenges for individuals with ID and DD? Is there a specific type of therapy or therapist I should ask or look for?
Mm-hmm. So, Avi mentioned counseling and the various approaches within that framework. And that's definitely a great approach, especially for our adult learners. But for some of our younger learners, those who are in early intervention or preschool, if their current level of development is such that they're not able to engage in vocal exchanges with others, and they have limited receptive language or the ability to respond to other people's language, my feeling is the best approach is applied behavior analysis or ABA. So in terms of a therapist, I would look for an ABA therapist, and I would not only have the ABA therapist work with the child, but I would have them work with the parent on creating strategies within the home to address the behaviors.
Thank you. Okay, guys, moving on to the third question. When should medication be considered in a person's treatment plan?
I'm going to let Avi answer this one because, as my bio says, I typically work with young children, so birth to age 5, and I would not recommend medication for that population, except for under very, very unique and extraordinary circumstances.
Mm-hmm. Yes, that's a good question. I mean, given that we're both here together on the panel, I focus more on adults. Michael focuses more on children. And so you're going to get a lot of different perspective, depending on the age group. For adults, what we do is we start from least restrictive to most restrictive when it comes to interventions. So we would have a functional assessment and a behavior plan, right? And if those things are not working, right? So you already, let's say, determine this person, their function is as attention, they seek attention, and I'm going to try to modify behavior by, conditioning them to ask for attention appropriately, right? You do all these things first. If that still doesn't work, then you might want to start exploring medication for that. Okay, so the medication might help with curbing the behavior. So, that's I guess in a nutshell, that's the way that I would describe how to do. And then at that point, you might have psychiatric evaluation. A psychiatrist might look at some medications that work specifically for that behavior.
Okay, thank you. And I think we do have time for this one final question. What recommendations do you have for how to immediately respond to sudden and extreme bursts of anxiety? Are there any general strategies that we should consider? Again,
it depends. I would say similar to a little bit to the last question in the sense of first, we're looking at what is the diagnosis, right? So is this anxiety due to generalized anxiety disorder? If that's the case, then there might be a genuine symptomatic, something going on, mood related, right? And if that's the case, you want anti-anxiety medication or something of that sort. But if it's just a behavior that seems to be like what do you call it? Like an impulsive behavior, right? Some people have impulse control disorder, things like that. That's when you go back to the behavior plan notion. You might want to consider a behavior plan because they might not have any sort of mood related thing. It might just be impulse. It might just be that impulse is what gets them their favorite toy or their favorite item, right? So the diagnosis is a huge factor with that. And I don't know if Michael, you want to add anything?
Well, outbursts of anxiety, I would ask, what does that look like? So what behaviors does the individual engage in when they're anxious? And from there, I would, determine what what consequences resulted from them engaging in these behaviors that we call anxiety. If it allows them to avoid something, then we would look at ways of replacing that behavior with an appropriate behavior. If it allowed them to access something or like a tangible item or attention from someone else, then we would also address it in a similar fashion. We would look for ways to replace it with appropriate behavior, and then perhaps put some strategies in place that reduce the likelihood that they would have this anxiety-ridden response.
Thank you, gentlemen, so much. At this very time, I'm going to say, if we did not get the opportunity to answer your question during the session, we will get to them after the event. I would like to extend another thank you to both Dr. Avigdor and Mr. Boardman for today's presentation. We truly appreciate it. Thank you all for joining us today. Following the conclusion of the event, you will receive an email with a link with the survey. Please complete that survey for your chance to win an Amazon gift card. I do hope you will stick around and join us for 3 p.m. for our mental health in children and adolescents, how to support your child. Thank you and have a great day.
Thanks so much.